You've got to decide that you're worth it. If it's you talking yourself through it, great. If you have somebody in your life talk you through it, the minute you feel like you're worth it, the other stuff is okay. I'd go get dental work, and instead of doing a crown and fixing the problem, we would just pull it, because that's what we had money to do, and that's where I was at. So I never really had any follow-up work. It was just get rid of the problem, get rid of the pain, and move forward, and then you end up with no teeth back on either side, and that causes different problems. So, but it's been about 20 years since I've really not had to think about it, you know.
The problem with extracting a tooth and not replacing it with something, whether that be an implant, a bridge, a partial, when you don't replace a tooth with something, the opposing tooth, so say we lose a lower tooth, the opposing tooth on the upper, a tooth will erupt. It doesn't grow, but it just keeps erupting, pushing through the bone until it hits something. Another problem is that when you have a missing tooth, you have a tooth on either side, the teeth all touch each other and they help keep each other in line. When you have a tooth that comes out, they can kind of drift together, and then you start exposing root surface on either side of those teeth. So now these teeth are the teeth on either side of that tooth are now more prone to getting decay. Other problems, such as in Jerilee's case, she lost a lot of back teeth. So when you do that, it's called collapsing your bite. So she had no back teeth to bite on, so now she's pounding away on her front teeth, and the front teeth were just not meant for that. So the front teeth are all single-rooted teeth. So now what used to be, she used to bite like this on her front teeth, and now they start to splay forward because they're getting too much pressure, and they start to move outward, and that's really the only way you can chew when you don't have back teeth. So it just, even though your front teeth may be good at first, they just start to damage those front teeth because they are just having too much pounding, too much pressure, and they just can't take it.
I had to watch what side I ate on and stuff, and then it felt like a nerve for a long time. I'd get a really bad headache on this one side, and they talked like maybe it was partly an infection in that area, and right up to my nasal cavity. And so I was worried about that. I couldn't eat a lot of different things. You know, I don't know the last time I had corn on the cob, all those things that you want to do. And I was lucky enough that I could hide that from people because it was in the back. But I was very self-conscious of all of that.
In her case, she had several abscesses, several areas of infection, and the infection on a tooth is generally at the root tip, which is kind of a weird thing. You'd think, you know, the part that's in your mouth, that's the part that gets infected. That is actually just the access. The part in your mouth is the access when you get a cavity in a tooth. The bacteria, the decay goes to the nerve of the tooth, and then it goes through a tunnel that's inside the tooth and goes all the way up to the root tip, and then it finds this nice soft bone beyond the root tip, and it expands and it grows. And so the pain she was feeling was these abscesses, these areas of infection where the bacteria in there are just breeding and growing and expanding, and that expansion eats away the bone around the root tip, and then eventually can cause the tooth to become loose. It also causes pain. It causes sensitivity to cold, sensitivity to heat, biting pressure sensitivity. And so that's why you have some patients who come in saying, you know, I have this pain going on for years, and it goes away and it comes back and it goes away. So that's what's going on. So it's actually a chronic infection, and it's always going on, but you don't always feel pain for it. So sometimes she'd notice it, and sometimes she wouldn't.
All right, now if you can take your mask off, show your husband your teeth. Oh, much better.
You're gonna be next, baby.
You want to see him?
Okay. Holy mother of pearl. Oh my gosh. Oh my gosh. That is amazing. You've got to decide that you're worth it. If it's you talking yourself through it, great. If you have somebody in your life talk you through it, the minute you feel like you're worth it, the other stuff is okay. Who wants to make a half choice and then pay for it 10 years down the road, or 5 years and have to have it redone? Everybody was so kind, and the consultations were really informative and made you feel comfortable and not judged. For me, that was a great call, you know. So my advice is just find it within yourself and somebody that loves you to go through it with you. And you'll be all right.
For every 15,000 subscribers, we are giving away a free smile. Click over here to subscribe and over here to watch the next video. And don't forget to click the bell so that you don't miss the next video.